A recent study from the Costs of War Project put the spotlight on an alarming milestone in the problem of veteran suicide. According to the report, 4 times as many veterans and service members have now died by suicide than have been killed in combat. While the Pentagon and Veterans Administration have long been looking for ways to reduce suicide rates, the issue continues to persist. For more on the study and the military's problem with suicide rates, we talked to Colonel Michael Hudson, who has worked closely with the Marine Corps in developing strategies to prevent suicide.
I think we need to change the way we are approaching it. And what I mean by that is this. There are people make assumptions and we build plans and we deploy those, right? But we have to be agile enough in our thinking to go, what's not working? So if you look at the veteran data since 2005, as that report talked about, there's been a steady increase in veteran suicide. You look at the DoD stuff and they're talking about in the last 5 years, there's been a steady increase. And so we have to challenge our assumptions. And the assumption that we're seeking to challenge is, why is it the veteran has to ask for help? Why is it the active duty service member needs to raise their hand and say, I need help? When they do, they get great support. There's all kinds of capability behind that ask. But what the data tells us is they're just not raising their hand. So we have to move this conversation left. And that's kind of the passion I have, is using technology in a way that it's not some big brother model. It's not a huge data scraping evolution. It's how do you identify people who are struggling? We're not saying they're suicidal. We're not saying they're a risk. We're simply saying within a population, how do you see? So I'm a vice president of government solutions at a Vienna-based company called ClearForce. We're just outside of the Washington, D.C. area, formed in 2015. And what it focuses on is using data. We're a software company, but we use data, privacy, and compliance to help organizations pick up on struggling employees. We try to pick up on those science and evidence-based risk indicators and have an organization do an outreach or a mitigation effort before it grows into a larger problem. Mental health, what you're seeing, a really good effort, and should highlight, is what the VA is doing with their concept of ReachFed. It's a relatively new program, but it's actually showing some really good promise. And what ReachFed does broadly is it uses artificial intelligence around clinical data, around medical data. And so if you're engaging with the VA in a clinical setting, they then use that data, they use questionnaires, surveillance, and then they stratify a risk population within there. So what ReachVet does is it uses data tied to artificial intelligence, machine learning, mapped to what we know about suicide in a clinical sense, and identify high-risk patients, and then they do an informed outreach. We think that's a really good set. What we want to do is get outside of that model and say, listen, we need to do that same level of active approach using technology and data to move left, right? How do we do that? That's where our technology and what we're doing today, I think, is super interesting, is using the social determinants as triggers. These are things like financial pressure, substance abuse, military sexual trauma on the outside, even on the inside, connectiveness. The CDC, and I would point you to their 2017 study by the CDC, did a really good job of identifying 7 critical areas that you want to be aware of. And they talk through those, and that's the financial pressures, that's the substance abuse, connectiveness, relationship, legal issues. These are all things that can be discovered outside of the work environment that today organizations tend to be blind to. We think by being able to use new technology to set triggers in that space, to do it with a high level of privacy protection with the goal of empowerment, we think that's going to change the narrative in the conversation. We're going to push resources to individuals by waiting for them to pull them.
If you were part of the leadership of the Pentagon or the VA, what kind of changes do you think would need to be done to make sure their efforts are more successful in stopping this benchmark from happening?
Yeah, I think first you have to compliment them for their efforts, right? So even though the numbers are going up, I can tell you from friends who are still working within the Department of Defense and within the VA, this is an all hands on deck effort. So let's be clear. The fact that the numbers are going up isn't because those organizations aren't fully switched on trying to make a difference. I want to be clear there. They're pushing all in to make a difference here. I think what needs to happen is when you look at something, you go, hey, we have this plan, we have this model, we're executing, but it doesn't seem to be getting where we want to go. I think at that point, you need to go back and challenge some of your assumptions. So if I was coaching up either team, I would say, so we recognize suicide's a hard problem. We recognize there's no silver bullet or silver lining to this. We have to find a way to understand this broadly. So I think we need to go back and challenge some of our assumptions. We need to go back and look at what we can do different. I think I would seek And they're doing that to some degree. Look for more agile and different ways to approach the problem. If it is an all hands on deck, let's bring the outside community. Let's bring science and technology. Let's expand it outside of just a mental health conversation, which is important. Let's look at the other side of that optic and see what we can do in that. And this is the key. Think about your own experience, Jesse, is organizations, if we can pick up on someone who is struggling sooner, we have a better outcome. We're not going to project that you're going to do a bad thing or that you're going to end your life by suicide. But what we can pick up on is you're under a great deal of pressure and stress. What happens in the military, that gets amplified because military members, and they carry that over as veterans, they tend to not want to ask for help. We tend to train them to solve the riddle, right? Keep moving forward. So sometimes in doing that, they withhold or keep inside. So what we need as leaders, we need is ability to kind of sense when someone is pushing beyond a normal set or a trigger set of lines. This is where we reach out. This is a resiliency conversation. This is a mental health conversation. This is a physical fitness conversation. They all weave together, but really the key in all of this is organizational awareness. We have to augment that. And that's what we think technology and science can help with.
The report suggests the military needs to promote, quote, help-seeking attitudes in a positive way. It also suggests an increase in medical screenings for issues such as PTSD, traumatic brain injuries, depression, and suicide ideation. For Defense News Weekly, I'm Jesse Karangu.